7 early nerve warnings that could start in your feet before you notice. Most people think nerve problems announce themselves loudly. They imagine severe pain, numb legs, or a diagnosis that suddenly appears one day. But that is not usually how nerve trouble begins. Very often, the first clues are quiet. They start in the feet. A little tingling, a little burning at night, a strange feeling in the toes, a small balance change, a patch of numb skin, something you notice for a few seconds, then ignore. And this is where people get fooled. Because after 50, many people blame these early signs on age, shoes, standing too long, or poor circulation. Sometimes those things do play a role. But when nerve signals begin changing in the feet, your body may be warning you long before the problem becomes obvious. Now, this does not mean every odd feeling in your feet is dangerous. Feet can ache from tight shoes, arthritis, dry skin, poor posture, or a long day of walking. But if these symptoms keep coming back, spread, worsen at night, or appear with diabetes, prediabetes, low vitamin B12, thyroid issues, kidney disease, heavy alcohol use, certain medications, or back problems, they deserve attention. Because nerves are like communication wires. They carry messages from your feet to your brain and from your brain back to your muscles. When those messages become irritated, slowed, or damaged, the feet are often the first place you notice it. The first early warning is tingling that feels like pins and needles. This may feel like tiny sparks in your toes, or like your foot is waking up even though you were not sitting on it. It may come and go at first. You may feel it more when you are resting, watching TV, or lying in bed. Most people miss this because tingling seems harmless, and sometimes it is. But repeated tingling can be an early sign that small nerves are irritated. This is especially important if the tingling starts in both feet, begins in the toes, and slowly moves upward over time. That pattern can happen with peripheral neuropathy, which simply means nerve dysfunction outside the brain and spinal cord. Diabetes and prediabetes are common causes, but they are not the only ones. Low B12, thyroid problems, kidney problems, alcohol, autoimmune conditions, and some medications can also affect nerves. So the clue is not one random tingle. The clue is a pattern that keeps returning. The second warning is burning, especially at night. This is one of the most common complaints people describe when nerves become irritated. The feet may feel hot, burning, prickly, or overly sensitive. Sometimes the skin looks normal, but inside it feels like heat is rising through the soles or toes. And this is where it gets interesting. Nerve burning often feels worse at night because there are fewer distractions. During the day, your brain is busy. At night, when everything is quiet, those abnormal nerve signals become louder. Some people say my feet burn when I get into bed, or I have to stick my feet out from under the blanket. Others say the sheets feel uncomfortable touching their toes. That sounds small, but it matters. Pain from irritated nerves does not always behave like muscle pain. It may burn, sting, zap, or feel electric. If that happens repeatedly, especially in both feet, it is worth discussing with a clinician. The third warning is numbness, or a dull feeling in the toes. Numbness can be tricky because it may not feel dramatic. You may simply notice that the floor feels different. Your socks feel strange. Your toes feel thick, padded, or less alive. You may step into the shower and realize one foot does not feel temperature as clearly as the other. This is where people get fooled. Pain gets attention. Numbness often gets ignored. But numbness can be more dangerous than pain because it reduces protection. If you cannot feel pressure, heat, friction, or a small cut, you may injure your foot and not notice. This is especially important for people with diabetes, because small foot injuries can become serious when sensation and circulation are not ideal. So if your feet feel less sensitive than before, do not brush it off. The absence of pain is not always a sign that everything is fine. Sometimes it means the warning system itself is getting quieter. The fourth warning is balance that feels slightly off. Many people never connect balance to nerve health. They think balance only comes from the inner ear or muscle strength. Those matter, but your feet also send position signals to your brain. They tell your brain where the ground is, how much pressure is under each foot, and how to adjust your posture. When those nerve signals weaken, you may feel less steady. You may stumble more often. You may feel unsure in the dark. You may need to look down more when walking. You may feel less confident on stairs, uneven ground, or when getting up at night. And this is why that matters more after 50. Falls become more dangerous with age. A small nerve problem in the feet can combine with weak leg muscles, poor vision, certain medications, or low blood pressure when standing, and suddenly the risk becomes bigger. Most people miss this early stage. They do not say my nerves are changing. They say I'm just not as steady as I used to be. But if balance changes come with tingling, numbness, burning, or weakness in the feet, nerves should be part of the conversation. The fifth warning is foot cramps, weakness, or toes that do not move like they used to. Nerves do not only carry feeling, they also help control muscles. When nerve messages to the small muscles of the feet become weaker, you may notice cramps, foot fatigue, toe weakness, or a strange dragging feeling. Maybe you trip over the front of your shoe more often. Maybe your toes do not grip the floor well. Maybe your feet feel tired after a short walk. Maybe you notice one foot slaps the ground harder than the other. This does not always come from neuropathy. It can also come from spine problems, pinched nerves, poor footwear, muscle loss, or circulation problems. But weakness is a warning sign that deserves more attention than occasional tingling. Because sensory symptoms are one thing, motor changes are another. If you notice new weakness, foot drop, worsening walking ability, or symptoms on one side that come suddenly, you should seek medical evaluation quickly. The sixth warning is skin changes, slow healing, or small injuries you did not feel. This is one of the most important clues, especially for people with diabetes or reduced sensation. You may find a blister and not remember getting it. A small cut may take longer to heal. The skin may become dry and cracked. Pressure spots may appear on the toes, heel, or ball of the foot. Shoes may rub, but you do not feel it until you see redness later. This is where people get fooled. They treat it like a skin problem only. But sometimes the deeper issue is that the nerves are not warning you early enough. That is why checking your feet matters, especially after 50, if you have diabetes, pre-diabetes, circulation problems, or known neuropathy. A quick look at your soles, toes, nails, and heels can prevent small problems from becoming bigger ones. And if you cannot easily see the bottom of your feet, use a mirror or ask for help. That one simple habit can protect you more than many expensive supplements. The seventh warning is symptoms that slowly climb upward. This is one of the most important patterns. If tingling, numbness, burning, or strange sensations begin in the toes and slowly move into the feet or ankles, pay attention. Many nerve problems follow a stalking pattern. That means symptoms begin where the longest nerves end, usually in the toes and feet, then gradually move upward. It may feel mild at first, but the direction matters. Most people wait until the symptoms become painful. But the smarter move is to act when the pattern first becomes clear. So what should you do if these warnings sound familiar? First, do not panic. These signs are not a diagnosis. They are clues. The goal is not to assume the worst. The goal is to find the cause early. Second, ask your clinician about common drivers. Blood sugar is a big one, including pre-diabetes. Vitamin B12 matters, especially if you take metformin, acid-reducing medicines, or eat very little animal protein. Thyroid function can matter. Kidney function can matter. Alcohol use, certain chemotherapy drugs, some antibiotics, autoimmune problems, and spine issues can also play a role. Third, protect your feet now. Wear shoes that fit well. Avoid walking barefoot if you have numbness. Check your feet regularly. Keep skin moisturized, but not wet between the toes. Trim nails carefully. And if you have diabetes, take foot changes seriously and get regular foot exams. Fourth, protect the nerves you still have. Better blood sugar control, strength training, walking if safe, enough sleep, balanced nutrition, and correcting deficiencies can make a real difference depending on the cause. And remember this, nerve problems are not always reversible, but many causes are treatable or manageable when caught early. That is why early signs matter. The feet often whisper before the body shouts. So if your feet are tingling, burning, going numb, feeling less steady, cramping, healing slowly, or showing symptoms that climb upward, do not dismiss it as just age. Age may explain some changes, but it should never be used to ignore a pattern. Your feet may be the first place your nerves ask for help, and the earlier you listen, the more you may be able to protect.